what role does the diaphragm play in ventilation? So recall that the diaphragm is a sheet of muscle located in the thorax, separating the thoracic cavity and the abdominal cavity. When the diaphragm contracts, it moves downward. Therefore, the size of the thoracic cavity will be increased, so increased thorax size. The result is going to be negative pressure in the thorax, and that pulls air in during inspiration. The opposite will occur when the diaphragm relaxes. It's going to move up, and there's going to be a decrease in the size of the thorax. Air then will rush out of the lungs during expiration. What role does pH have in the regulation of breathing by the medulla? Well, the medulla monitors pH in the CSF. And the pH in the CSF mirrors the pH in the blood. So this is a measure of pH in the blood. And in the blood, when CO2 increases, the result is that pH decreases. Because recall, CO2 plus water form carbonic acid, which dissociates to bicarbonate ion and hydrogen ion. So increased CO2 translates to increased hydrogen ion, which is decreased pH. Decreased pH leads to the medulla to increase the rate and depth of breathing. So when the medulla senses that pH has dropped, there is an increase in the rate and depth of breathing. So that concludes this lecture on the respiratory system. Thanks for visiting Educator.com.